First, let's take a look at some of, well, you know what? First, we're going to check in with Dr. Lauren Streicher. He's here from Northwestern University. He's going to answer some medical questions for us. How you doing? Good to see you again.
Good to see you.
Hi.
All right, let's start with the most popular oral nasal decongestant that's been deemed ineffective.
Beyond ineffective. We are talking completely worthless.
And this is in every cold medicine?
Pretty much. It's phenylephrine, and you name it, it's in there. We're talking Dayquil, we're talking Sudafed. All of these decongestants that people are buying are doing absolutely nothing. Now, just to be clear, we are not talking about nasal spray. Nasal spray works. We're talking about the oral stuff, the capsules, the liquid stuff. And basically, it's been known for years in scientific articles that it's not doing anything. And the reason it's not doing anything is because of a concept of bioavailability. And basically what that means is how much of the medicine gets where it needs to go and does what it needs to do. And they found that the bioavailability of the stuff that you take orally is less than 1%. So you can take a whole bottle of this stuff and it's not going to do anything. But this is the part that makes my blood boil. As this has been known for a while. The FDA came out a month ago and said, ineffective, does nothing. It's all still on the market. I just went on Amazon this morning to see if you can still buy this stuff. And Americans spent $2 billion last year because this is the go-to. You know, you've got runny nose, you've got a cold, you're congested. Yeah. You go and you pick up one of these products and it's doing nothing. So I'm okay with the idea that science changes, and and we realized there was flawed reasoning and flawed science that made them think it did do something. But now that we know it's worthless, why is it still out there?
So my question is this: I know at least sometimes these pills have multiple things in them, like acetaminophen or antihistamine. So does it mean it's still worth taking for that?
Well, yeah, I mean, if it has, for example, acetaminophen in it, is it going to help with your aches and your pains and your fever? Yes. But specifically, what the phenylephrine is supposed to do is to shrink the blood vessels in the nose to dry up your nose. And that's not happening unless you use the nasal spray.
Gotcha.
Nasal spray.
Wow. All right. How about an abnormal test? Not always an indication of cancer.
This is really interesting. So last week I was at the menopause conference in Philadelphia, and a lot of new research came out. And one of the scientific studies that was presented is looking at abnormal Pap tests in perimenopause women. And it turns out this was a study of 1,500 perimenopause and newly menopausal women who had abnormal Pap tests, kind of out of the blue. You know, these were not high-risk women. And what they found is that it was the hormonal changes that were drying out the cells of the cervix that made these Pap tests look abnormal when in fact there was nothing wrong with their cervix. And they treated women with vaginal estrogen and then repeated the Pap test 2 months later, and in almost 98% of them, it was completely normal. So the take-home message here is if you are perimenopausal or postmenopausal and you get an abnormal Pap test, you still have to follow up. Don't ignore it. But you might suggest to your doctor that, hey, maybe a little estrogen might help, and repeat the Pap test before you start doing things like biopsies and colposcopies.
Gotcha.
So big change there in terms of how we regard those tests.
And a surprising benefit to toothbrush.
Yeah, brushing your teeth. Okay, first of all, let's start with the fact that 20% of Americans do not have good oral hygiene. They don't brush their teeth regularly. They don't floss. They just, Robin, you've got this look on your face.
I don't get how what are you doing if you're not brushing your teeth?
They're not. I don't know what they're doing, but they're not. And it has been known for some time that there's a huge association with poor dental hygiene and a lot of serious medical problems like cardiovascular disease, lung problems, some mouth cancers, and increase in diabetes. In fact, one study came out showing that if you brush your teeth twice a day and you're a type 2 diabetic, that you will lower your hemoglobin A1C. But the thing that's really emerging, that's really interesting, is the association of poor dental hygiene and dementia and Alzheimer's. And there's been a few studies which have come out which have shown that there is a 6-fold higher risk of dementia and developing Alzheimer's in people that have poor dental hygiene. Why? Well, there's the bacteria that's supposed to live in your mouth. But if you have poor dental hygiene, it gets into your bloodstream. In addition to the chronic inflammation, you can get this bacteria that's traveling to the brain. And in fact, in recent studies, they have found oral bacteria in cerebral spinal fluid, and which is higher in people that have Alzheimer's. So, I mean, we can't do anything about our genetics, but there's a lot of things that you can do that's going to decrease your risk of dementia down the road. And we know things like checking your hearing and keeping your blood pressure in control. But now you can add to the list, brush your teeth and go to the dentist and make sure your gums are healthy.
Wow. All right. Well, you can check out Dr. Stryker on social media. Thanks again for being here.
Thank you. Time for Around Town.
Hey, Anna.